worked fantastically for me. There was very little pain after the operation as well. Recovery was extremely quick.
I was in the hospital for overnight, went home the next day, walked with a walker for a day or so, and was completely mobile at the end of a week.
I was real happy that I was able to leave the hospital right away, the next day actually. It was just a good feeling to know that I didn't have to stay longer, or as I had heard, some people would have to go to rehab after surgery. I didn't have to worry about any of that.
I haven't had one complication from the surgery. It just seems like I progressed so fast, and the pain is gone. It's like I never had the operation at this point.
Developed as an alternative to traditional total hip replacement, the SuperPath hip technique is a tissue-sparing approach intended to get patients back on their feet within days instead of weeks or months. Patients who have undergone this operation are generally able to walk unassisted or with single-sided support on day one. SuperPath is a patented technique that allows the total hip procedure to be performed without dislocating the femur. By avoiding the traditional cutting of 4 to 5 tendons around the hip, there is typically less trauma and therefore less pain, less bleeding, and more tissue left intact when compared to traditional hip surgery. In addition, the SuperPath technique permits proper cutting of the femoral neck and discourages the chance of femoral fracture during implantation of the stem. The key to any successful tissue-sparing approach is the avoidance of trauma to the soft tissue structures around the hip. The SuperPath hip technique offers a tissue-sparing approach that does not require the cutting of any muscles. This allows the average SuperPath patient to leave the hospital in as little as 2 days after surgery, and without the typical hip bending restrictions associated with traditional total hip replacement.
I really would highly recommend anybody who is having hip problems to go this route. It is so much less invasive than the other procedure, and it enables you to do so many things very quickly. If I had it to go over again, I would do it in a minute.
I had surgery on Thursday and I walked on Sunday, so 3 days from the point of surgery I put my cane in the corner and started walking on my own.
Well, I've talked to other people who have had hip surgery, and I've seen their recovery period, which has been rather long. And I am absolutely amazed that it's been just almost exactly a month since my surgery, and I'm walking without the assistance of a cane. I'm able to walk with my neighbor. I'm able to ride my bike. I can walk my dog. There isn't too much that I'm not able to do right now.
My surgeon told me to do, Dr. Grandick told me to do what I felt comfortable doing. I was really surprised because I have some good friends that are physical therapists, and they were just blown away by that. I can walk, I can go up steps, I can do this, and you know, I can get in and out of the dryer, and they're like, oh wow.
The patient is placed on his or her side on the operating table, with the leg that is to be operated on bent 45 degrees. The surgical incision starts at the top of the femur and extends 2.5 to 3 inches above this point. The gluteus minimus muscle is moved forward, while the external rotator muscles are moved rearward, allowing excellent access to the hip joint without cutting the soft tissues. The femur is prepared according to the design of the stem implant, and the final femoral instrument is used to make an accurate neck cut and remove the femoral head. Using an alignment instrument for proper implant positioning, a tube is inserted to allow preparation of the acetabulum and implantation of the cup. The acetabular cup implant is positioned using the alignment instrument and impacted through the tube. After positioning the cup liner and femoral head implant, the stem implant is firmly impacted. The leg is then raised to join the femoral neck and femoral head implants and complete the procedure.
Well, I think I got out of surgery about 11 o'clock, and at 3 o'clock was the first time that I walked, which was pretty amazing.
I felt I made the right decision in choosing SuperPath almost immediately. When I saw the size of the scar and I saw that I was walking that same day and I was walking the halls the next day, I was very happy I went that route.
In the end, I only missed 2 days of work from a total hip replacement. I missed work on Thursday and Friday, had the weekend to recover, and by Monday I was ready to go.
I think the SuperPath technique was the most positive thing that ever happened to me.
SuperPath micro-posterior approach. Minimal trauma and therefore minimal pain and minimal bleeding as compared to traditional hip surgery. Talk to your doctor and see if this innovative hip replacement procedure is right for you. Hip systems manufactured by Microport Orthopedics are designed to relieve hip pain and improve hip function by replacing the parts of your hip that have been severely damaged by degenerative joint diseases. You should not receive a Microport Orthopedics hip system if you have an infection of the body or blood, your bones are not yet fully grown, your bones are not strong enough or healthy enough because you have severe bone loss, osteoporosis, or have a family history of severe bone loss. You have any blood vessel-related disease, muscle-related disease, or nerve and muscle-related disease that may prevent the artificial hip joint device from remaining stable or that may prevent you from following instructions during the recovery period. You have a suppressed immune system due to diseases such as AIDS, or are receiving high doses of corticosteroids, or you are severely overweight. As with any major surgical procedure, there are risks and recovery times. Potential adverse effects which may result from hip replacement include, but are not limited to, the following: pain, bone or component fracture, blood vessel damage or blockage, temporary or permanent nerve damage, a sudden drop in blood pressure during surgery due to the use of bone cement, leg deformity, blood clots that can travel to your heart or lungs, delayed wound healing, and deep wound infection or accelerated wear of the prosthesis, which may necessitate additional surgery. Your weight, age, and medical history determine your specific risks. You should ask your doctor to explain all of the risks of surgery to you and what type of rehabilitation you can expect. Your doctor may request that you attend physical therapy. Your doctor may also give you additional signs and symptoms for which to be aware. Hip replacement implants cannot be expected to perform as well as your natural joint and carry the risks of breakage and wear, particularly if you lead a very active lifestyle or place a lot of demand on the implant. The results described in this video are specific to these individuals. You should tell your doctor about your full medical history, occupation, and lifestyle, or if you think you might have a hard time following any instructions you are given regarding your hip replacement. If the implant does break or wear out, you may need additional surgery.
These results are specific to this individual only. Individual results and activity levels after surgery vary and depend on many factors including age, weight, and prior activity level. There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.
About 3 years ago, I was playing golf in Dallas, and I hit a shot, and there was a pain in my left hip that sent me straight to my knees. Relocated to the Memphis area and started doing P90X. And doing P90X, I really started to do some damage. I started to look into my different options. And if anything, if you take anything away from my story, it's that I know a lot about my options when it comes to a hip replacement. And I probably overanalyzed this decision as far as what I was going to do, when I was going to do it. You know, I put it off thinking, you know, I can get through this. You know, everybody at work had an opinion. All the doctors that I work with had opinions. I had a million different opinions in my head as to what I should or should not do. What products, what surgeon, you know, what surgical procedure. And, you know, after all of that, I came to the conclusion that I wanted to go talk to Dr. William Kurtz in Nashville about doing a SuperPath. And the more I learned about SuperPath, the more I realized, you know, I need to really get to know this well. And, you know, this may be the route I need to go, but I really need to make sure I understand the surgical procedure and really what the recovery looks like. Part of why I've been in denial and put this off is I did not want to have to go through the recovery. My dad had a hip replacement. My you know, hip problems are genetic arthritis. You know, I inherited it basically from my dad. He went through the same thing. I watched him go through a normal posterior total hip, and he had a really tough time recovering. And that was the last thing I want to do right now. I'm extremely busy with work. I can't afford to be out for 2 months, you know, recovering from a hip surgery. So when I started talking, even Dr. Kurtz was like, yeah, you can walk that afternoon, you know, of the surgery. You know, have surgery that morning, you know, I want you to walk that afternoon. What gave me the courage to go ahead and get this surgery done now was SuperPath. Bottom line, knowing that, you know, it's you know, so much less invasive, it gave me the courage to say, it's time to go get this done. And I think as more and more patients, you know, get the word out there that they can have this type of recovery versus going through what my dad went through, then they'd be crazy not to demand this from their surgeons. People are saying, are you ready? Are you ready for surgery? And I'm like, absolutely. You get to a point when you need a hip replacement that you're in so much pain all the time and you can barely do anything day to day. It's hard for me to put my shoes and socks on. You know, so yes, you know, when you get to that point, you can't wait to have surgery. And then if you know that the surgery is not going to be as bad as what people used to have to go through, and you can have a SuperPath and recover this quickly, I'm ready tomorrow. It's about 6 o'clock in the morning, and they're about to take me back. My surgery is at 7:30 this morning. The thought is that with SuperPath, I'll be walking as soon as noon, so 12:30, hopefully I'll be walking. The biggest question I've had over the last 2 days is, are you nervous? I have to admit, the fact that I'm having SuperPath and I've got Dr. Kurtz, I'm pretty relaxed. These guys are saying, hey, you seem pretty relaxed. I actually am. It's amazing what this surgery does for the patient. I think that's why I'm here talking to you guys now, is people need to understand the difference between getting a regular hip replacement versus getting a SuperPath. It's life-changing. I should be seeing you guys in about 5 hours walking with my new hip. So I'll see you all then. Thanks. Okay, so we are 3 months out from surgery, and I wanted to run through a timeline of how well my recovery went. And you know, up front, I have to say, I'm amazed at how easy the recovery was and how great I feel today. I mean, it's truly been life-changing. I've got my quality of life back, and I'm extremely excited to share with you guys, you know, exactly what happened from the point I had surgery. So at 4 hours after surgery, I walked in the hospital with a walker, and it was hospital policy that I had to have the walker. They had to have a nurse standing next to me. The next day, 7 a.m., bright and early, I got up and walked with a cane. So I didn't have to use the walker. They let me use a cane the next day. And again, I felt like I could walk without the cane, and I felt great the next morning. I had surgery on Thursday, and I walked on Sunday. So 3 days from the point of surgery, I put my cane in the corner and started walking on my own. Saturday night, I took one of my painkillers before I went to bed, got a good night's sleep, and on Sunday, I never took another pain med, and I never took any more pain meds from that point on. So I was only on pain medication for 2.5 days. On Monday, I was no longer on pain meds. I'm walking around the house. I was bored, so I was like, you know, what the heck, I'm gonna go ahead and work. And I worked from the house that day, and I made phone calls, got on email. but I felt completely fine. And so in the end, I only missed 2 days of work from a total hip replacement. I missed work on Thursday and Friday, had the weekend to recover, and by Monday I was ready to go. And so it's just a testimony to, you know, how great SuperPath is for the patient. I mean, the fact that you can recover that quickly and only miss 2 days of work, I couldn't be more excited, because that was the main reason I was hesitant to even take the surgery, was worried about how much time I was going to miss from work.
Our family really noticed a quality of life change. Steve just couldn't do basic things like taking our dog on a walk around the block. He couldn't go jog with me anymore. And he just limped all the time and was in lots of pain and complained about it through the night. And it was just hard to watch him go through that process. He couldn't enjoy golfing. His golf game was getting worse. He couldn't do a lot of the fun activities that we all do together. So you feel like you're sitting on the sidelines of life. The recovery process with SuperPath was amazing. It was such a rewarding experience, because I thought we would be in the hospital for at least 2 nights. We were out after the first night, driving home, and by the end of the weekend, Steve was walking up and down the stairs. We did not think he would be able to do that. Steve's quality of life is so much better, and we have SuperPath to thank for that.
These results are specific to this individual only. Individual results and activity levels after surgery vary and depend on many factors, including age, weight, and prior activity level.
Well, I like to go do a lot of hiking and walking, because I have 2 dogs, so I like to take them for a nice long walk. And I also like to golf. I'm pretty active. I go to the gym. Pain first started when it was pretty mild. I didn't pay too much attention to it because I could tolerate the pain. However, as time passed, I noticed that the pain was increasing. After a month and a half or 2, I realized that this is something that it's not normal. I could barely walk without stopping for a moment to relax. I could not walk my dogs because they were hurting me when I was walking 2 of them. And when I tried to golf, that was just next to impossible. I just couldn't do it. When I went to see Dr. Chada, he had authorized me to go get an MRI, and the MRI result indicated that I had avascular necrosis, and he could understand why I was going through all that pain, and he suggested that I should have a hip replacement. I learned about the SuperPath from Dr. Chada when I saw him the second time after the MRI result showed, and he was going to explain to me about the hip replacement. He gave me the 2 types of hip replacement. One was the traditional hip replacement and what to anticipate with that, and then the SuperPath with the minimal time of recovery, avoiding cutting the muscles, and he educated me on how quickly the recovery was, and that's why I chose the SuperPath. When I had my left hip replaced and I was in the recovery room, I was up within 4 hours walking with no help at all, and I realized that I was pain-free, and that's remarkable. I was so happy to find out that within 23 hours I was going to go home, and I never anticipated that quick response of recovery that I had. I was so happy to be in my own home, in my own bed, about a month and a half or 2 months after my surgery, after my therapy. I felt like I could go do anything I wanted to. It took a year and a half after my left hip was replaced that I realized I was going through the same pains on my right hip. Since I already went through this the first time and realizing what the pains were, I immediately consulted Dr. Chada, and we had an MRI performed, and we discovered that the right hip was now being affected by the same avascular necrosis. When I had the right hip replaced, I anticipated the same amount of recovery time, but to my amazement, within an hour after surgery, I was able to walk unassisted to the bathroom. And as the day progressed, Dr. Chada felt there was no reason for me to stay for a longer period of time, so I went in the morning at 8 o'clock, and by 5 o'clock I was already at home. And that is incredible. I feel extremely wonderful. I feel great that I can do all the things I want to do, like golfing regularly, working out at the gym, hiking, walking my dogs, and any other things that I can possibly do to have fun.
There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.